Oh, there we go. Okay.
Ah,
You kept
fine.
sending so many requests. It was so I was like, what's going on? Hi. Hi, hi, hi. Good to
Hey, how
see
are you?
you. Good, good, good. All right. You're doing okay?
Wonderful. Thank you.
Perfect.
Sorry
No,
about the
no
technical
problem.
difficulties.
Listen, it's all good. It's all good. You're here. I'm excited to have you here. We're gonna start and I think we're going to be talking about a very important topic. I mean, I've been on quite a few interviews. I've talked to a lot of women. One of the things that I get asked is, what's the role of trackers? How do we track our sleep? How do we monitor it? And really, what I want this talk to be about, what this chat or candid conversation to be about, is how do we safely use data to change our health, especially when it comes to our sleep health. So I think we'll get started. Hi, everyone. For those who don't know me, I'm Dr. Funke Afolabi-Brown. Where have you been? Why don't you know me? But hey, I'm Dr. Funke Afolabi-Brown. I'm the founder of Restful Sleep MD, where I help busy women and their children change their relationship with sleep so they can sleep better, thrive, and reach their fullest potential. I'm just going to put a plug in. The Restful Sleep Place is open for appointments, so you can start booking your appointments. We're going to be providing services to children and young adults with sleep-related issues. If you're located in Pennsylvania and New Jersey, it's all by telehealth, and we'll talk a little bit more about how do you take care of people virtually when they have sleep issues, because that's something that Dr. Chopra is really a guru and an expert at. So we're going to be learning a lot about that. But really, really good to have you here, Dr. Chopra. Can you introduce yourself to our people?
Yeah, hello everybody. My name is Sahil. I'm one of the co-founders here at Empower Sleep. I have pretty humble beginnings. I went to med school in India. I did residency in internal medicine at UCLA. I worked as an internist for a few years until I became interested in pulmonary critical care medicine. I love taking care of the most sickest people in the hospital. And then after that, I became interested in sleep. And I had the privilege to be on the East Coast too with Dr. Brown, except I was a little bit north in Boston at Harvard, while Dr. Brown was in Pennsylvania. And ever since then, the idea has been, how do we provide Harvard-grade sleep care to patients all across the country? So a little bit about myself, a little bit about Empower Sleep, and I would love to answer any questions that the audience has. And Dr. Brown, please call me Sahil. I think it'll just be a more candid conversation.
Well, if you're gonna call me Funke, because there's no way you can say Dr. Brown call me Sahil. It doesn't work like that. Anyway, so yeah, I love that. And we've watched this journey with Empower Sleep. But maybe tell us a little bit about what is Empower Sleep, and then we'll delve into more of the monitoring and things like that.
So, Empower Sleep is a virtual care platform that helps patients get a personalized solution for whatever sleep struggle they are dealing with. We use medical grade tools like medical grade home sleep testing devices, and we connect you to experts in the field so that you can get an end-to-end solution from the comfort of your home. So for example, if someone has sleep apnea, they can see a doctor with us. They can get multiple nights of sleep testing to understand their sleep physiology. And if a CPAP machine was the right tool for them, then it would be prescribed and delivered directly to your home. And then we would help you navigate that journey until you are successful. Whether you have insomnia or sleep apnea, we want to be able to help you get a very personalized solution from the comfort of your home. And what makes us very different is the fact that we want to help you optimize your sleep health, right? Like the idea of, if I said that treating hypertension or high blood pressure is very different than optimizing cardiovascular health, the same thing is true for sleep. Treating sleep apnea or insomnia or circadian rhythm disorder is very different than helping somebody improve their sleep health, Because when we unpack this idea of sleep health, then that means like the quality of sleep needs to be better, the duration, the timing, and the overall physiology of sleep needs to be as close to normal as possible. And we try to help people do that using medical grade continuous home sleep testing devices. Um, we're replicating what continuous glucose monitors have done for diabetics, and we're applying that to sleep. So a patient can do a sleep test every single night using a device that goes on their finger and understand their physiology and get the right guidance on what would be the best thing to help you improve your sleep.
Yeah, I know, and though this is just phenomenal. I think this is really honestly cutting edge because this is not how we have sort of practice sleep medicine conventionally. So for those of you out there who may wonder, when we talk about sleep health, you may have heard things like sleep apnea, insomnia. Those are sleep disorders. And beyond those sleep disorders, there's actually making sure that you get good quality sleep, like Dr. Chopra said, good quantity sleep, and that you are waking up feeling refreshed. And so usually when we're trying to make a diagnosis of a sleep disorder, for example, sleep apnea, which is one of the most common ones that people know about, we will either bring you into a sleep lab to get tested or do what you call a home sleep test. And we do know that while this is, very, very helpful, sometimes there may be changes that are not reflected on the night when you did the sleep study. So this tool, I think, is really, really phenomenal. And we're going to talk a little bit more about it. But even before we get there, I wanted us to take a couple of steps back and even talk about tracking sleep and monitoring sleep, right? Because right now people are very passionate about making the right choices, right? So we'll hear a lot about, the Oura Ring, the Apple, the Fitbit, all the devices. There's so many out there. And number one, what do you think about that? Because people are asking, well, I didn't get good quality sleep. Why? Well, because my tracker said I only had, 5% deep sleep. Like, what are your thoughts about that? Yes, no, maybe so. I just wanted to hear that because, that's a question people ask all the time. And also, I think what we'll then do is kind of compare that to some of the systems and these mechanisms that you have in place.
Yeah, so I have my Garmin watch too. So like I'm kind of
Yes,
a
me too.
sleep, yeah. So I'm a big a sleep nerd, and I think these tools have. So what used to so the funny thing is what used to happen, sleeping less was considered macho, like maybe a decade, 1.5 decades ago, and with the advent of like these consumer grade devices, it's changed the culture around sleep in the sense like now people are giving sleep giving sleep an importance. And so these consumer grade trackers and wearable devices have been pivotal for I think us in the sleep space because it drives this awareness that sleep is very important. Having high quality sleep is critical to your life. And if the recorder tells us that something is wrong, it at least flags something for the patient to say, hey, I think this is not normal. Maybe I should go talk to somebody about it. So I've always been very pro and excited of like these trackers getting better because they are driving awareness. They are helping people develop better habits. When it comes to sleep hygiene, they're helping them run good experiments so that they don't end up on this path of a sleep disorder per se. Like if I know that I'm not a good sleeper based on my tracker, maybe that could be enough information for me to now change my behaviors. So I'm not working in bed with my laptop. I'm not watching television in bed. I'm not doing all of these things. And I'm just more mindful of my own sleep health to begin with, so I don't go this path of like developing all these behaviors that propagate insomnia. And I can just sort of identify things sooner, solve them faster, And if there is a problem, maybe I can seek help sooner rather than waiting a few years.
Hmm.
So I think
Yeah,
they're phenomenal.
I I I I love your take on it. I think to the other end of the spectrum, which I do work with a lot of women, and that's one thing I just want to put that plug and that caveat out. Now, if you're someone who's already worried about your sleep, that you're getting bad sleep, or you're not sleeping enough, or you're having difficulties sleeping, like falling asleep, staying asleep, or you're waking up early, i.e., you have insomnia, even if you've not really had that diagnosis made, you just do have to be cautious, because what I see is a lot of women and men, of course, get it into their heads where the obsession is about, okay, what did my tracker say? And almost like going into bed feeling like, okay, there's almost like a sleep performance anxiety. Like, am I going to do well? Did I pass or fail over the night? So, but if you're someone who is just looking to improve your general sleep health, you notice like, okay, you know what? I feel very kind of groggy during the day. Is it a duration issue? Is it what are the trends here? Then I think this is a very, very useful tool. Um, that being said, I think the algorithms, from my understanding, and you can correct me if I'm wrong, we don't really know, right? We're not necessarily sure how accurate some of them are, especially when it comes to classifying whether you're in deep sleep or REM sleep, which is really what a lot of people become very sort of fascinated about. But if it's more of trends, did I wake up in the middle of the night? When did I fall asleep? How long was I in bed? I think it provides a lot of very, very useful information that can actually improve your sleep health. And I think when I talk about sleep monitoring in women, and as I was saying, when I thought about us having this live, I'm like, the first thing people think about is, oh yes, which device is the most accurate? Which one should I use to track my sleep of the commercial grade? But I want us to take that shift a little, because just the same way that your sleep tracker may show fluctuations, right? If you drank a lot of alcohol, or you drank caffeine before you went to bed, then your sleep tracker may show that your sleep is a little bit more fragmented, right? So there are variations, which are really the trends we recommend using these devices for, to kind of look at the variation, look at the trends, and make decisions based on that. But now you have sort of taken this and now brought it into your practice. And I think it's just such a phenomenal model. And I know you're sort of started talking to us about almost, I love that analogy of continuous glucose monitoring for those who might have a family member or are diabetic, right? You're monitoring your glucose over time, and you're seeing changes based on decisions you make, and you're making decisions based on those changes that you see, right? I love you bringing that into sleep. So maybe what we could also talk about is, what are some conditions that you would be screening for using this modality, and maybe tell us even a little bit more about it.
Yeah, I know. Great question. The the way the way that I sort of share about these home sleep testing devices
Hmm.
is it's a sleep health examination. Okay, like, well, let's look at the health of your sleep. Let's look at the quality. Let's look at the breathing components. Let's look at the cardiovascular components. So once we look at it from that lens, these tests can be used to identify sleep apnea.
Hmm.
They can also then look at the different types of sleep apnea using the same test. They can help us understand insomnia. Is it insomnia with preserved sleep quality, or is it insomnia with impaired sleep quality? Because both of them behave very differently.
Hmm.
And those are like the two main areas I would say that um, where they are the most impactful. And
Hmm.
the third is, once you've identified a problem and you try to treat it or solve it, you can then continue to track and see how good of a job am I doing as a provider and the patient solving this problem. So if they have sleep apnea and you put them on a CPAP device or a dental appliance, but there's still residual pauses in breathing from sleep apnea, or you put them on, they have mild sleep apnea and they don't need CPAP, maybe something like lip tape and side sleeping is just good enough that it is, and it is equivalent to something like CPAP or a dental appliance. So it really allows us to become very granular with how we look at someone's sleep and how we make recommendations.
Mm-hmm.
So I would say like the three big things is like people who have insomnia and sleep apnea, and then the third component is um, when we make recommendations, those recommendations are very precise, backed by data, rather than backed by subjectivity and how one feels.
Mm-hmm. So let me create let me give some perspective. So, I mean, typically the traditional way by which we do this is you have someone who is snoring, or your spouse or someone you know is snoring, right? You send them to get a sleep test. Again, that can either be done in a sleep lab. For children, we tend to do that in the sleep lab, or you send them a kit where it's the home sleep apnea test kit, right? They get that study. Usually, it's maybe 1 or 2 nights. So that's the traditional. That once you're done doing the study, the data, the information gets uploaded to a cloud, and then it's sent to the physician or the ordering provider, who will read it, interpret it, and then tell you, yes, you have sleep apnea. And based on the results of this sleep apnea, we recommend, this, that, and the other. Now, just for those of you who may not be aware, there are different ways by which we treat sleep apnea. It might be CPAP. It might be position, especially if your sleep apnea is worse when you're on your back. Or now there's some, there are oral appliances and some other treatment options that are available. So not everybody needs to be on CPAP, okay? And so after that, once those recommendations are made, you start using the device, right? And most times there are different ways by which we can check is the device working. Number one, do you feel better, right? That's the hope. If you had sleep apnea and that was the reason why you're so tired, and now we're treating you with the right treatment, you should feel better. So subjectively, you feel better. You tell your doctor, listen, doctor, you did it. I'm all good. Or you do another test, another sleep study on the treatment, another one-time study, right? So we either bring you back into the lab, or we could send the kid back home and we check you to see if the sleep apnea is completely resolved. And that's our hope. Alternatively, now a lot of the CPAP devices have these downloads that we can check, and we can use it to sort of tailor your treatment to make sure that you're on the right amount of pressure through the CPAP. So that's another way to check how you're responding to treatment. But the technology you're talking about sounds like it isn't just one time. We're doing this overnight. We're starting the treatment, and then we're monitoring subsequently, rather than just a one-time thing. So how do you feel that has been beneficial, especially for the people that you've used this on, compared to our traditional modalities?
Yeah, it's been a game changer, Funky. And like we've talked about this before. Over the week, over a couple of things. The first is you were giving this example of these reports that one gets from a CPAP device. It gives us breathing information. It gives us leak information, and we assume that usage is sleep information. They don't really tell us anything about sleep. They don't tell us if someone is actually sleeping well with the CPAP device. They just tell us that you are breathing well with the CPAP device. Whether or not the CPAP has improved your sleep or not, that's a fundamentally different question that has not been addressed. So that, I think, is a game changer, one. And then the second thing is um, we can compare what's the right tool for you, right? Like this weekend, I had a patient who had called me. There's a device called INAP. You're probably familiar with it. It's a little tongue suctioning device for sleep apnea. And she was comparing how was her sleep with a CPAP machine versus an INAP machine. And she did 3 or 4 days of CPAP, and she's doing well. She came to us with apnea indices in the 70s to 80s.
So
and
that's
now it's,
very severe.
right,
That's really severe for those who don't know.
very severe sleep apnea, and now she's
Hmm.
doing phenomenally better. But she's curious, like, hey, I know I'm doing well with this CPAP machine. I wonder if there's something else that I could benefit from. So now she's using a different tool for sleep apnea, and she's not doing as well. Historically, that would not have been possible. This person
Hmm.
would have had to go to a sleep lab and maybe get an in-lab study, but now they can test, and they can test different therapeutic modalities in the comfort of their home across multiple days in a very cost-effective way. So it's definitely been a game changer for us to, one, help people improve the quality of their sleep, and then two, to help them compare different interventions to figure out what's the right intervention for you and what would make you feel the best, because you're going to be using this for a pretty long period of time.
Yeah. Yeah, that is so powerful. Thanks for sharing that. Now, I think when we just try to project into the future, right? Technology is exploding, right? I think this work is, it needs to get out there as much as possible. In terms of just feasibility, practicality, and the kind of impact it can have in people's lives, where do you see this going? Like, where do you see Empower Sleep going with this tool?
You know, the vision for what we're doing is, um, like, imagine if someone has diabetes and they're
Mm-hmm.
using a continuous glucose monitor,
Mm-hmm.
and that individual has the ability to take a picture of their food to get some kind of carb count, and they're also connected to an insulin pump. So now you have a diagnostic tool, you have a treatment like an insulin pump, and you have context of like what is happening. So imagine if all that data could be pulled together and analyzed with software to automatically give insulin in a way that it should be given, rather than the patient having to give directions to the pump of what to do.
Mm-hmm.
Sleep care can be managed in the same way, where a patient can continue to do sleep testing, and the software can give soft nudges that, hey, when you tried X, there was a 50% improvement in your quality of sleep, so why don't you continue to do this? And or if you tried Y and there was a reduction in your quality of sleep and it did not help, let's not do this intervention. So where we hope to go in the next few years is really this model where software using data from different devices and context can give patients insight into what behaviors to develop, what interventions to try under the supervision of a care team, so that millions of people can get an end-to-end solution with sort of this asynchronous model for sleep care, but still have the ability to connect with clinicians on an ongoing basis. This
That's,
care is
that's amazing.
yeah, yeah. So long story short, that's basically where we plan to go with what we're doing.
And I just think that's incredible because we're talking actually improving sleep health. And one of the things I say, and Dr. Chopra as well, is also we're on the same bandwagon. We're sleep physicians, we're not sleep apnea doctors, right? So beyond sleep apnea, there's so many other things that you could improve with your sleep, right? Because I can imagine if you have this tool where, again, you have that person who's like, well, I wonder, I've been feeling kind of crappy. I notice after I have a glass of wine, my sleep just feels very weird. And then they use this to track to say, oh, wow, yeah, of course it's weird. I had this really poor sleep quality based on the data from my sleep tracking. So I think that's just really incredible. And again, I love the way that you compare it to continuous glucose monitoring. And we really should start to see sleep health this way. We really should start to see it as a longitudinal care. that affects even our risk of developing conditions like diabetes that's going to need continuous glucose monitoring. So thank you so much for shedding light on this. Now, I talked a little bit about mentioned a little bit about different treatment options for sleep apnea. We talked about CPAP. We talked a little bit about position therapy. Can you just, as we round this up, can you just let us know just some of the major treatment options that are there? Because I have people that actually say, I'm not going to get tested for sleep apnea because I do not want to wear CPAP. I'm never going to wear CPAP. So can we just speak to that mom that may be out there who wakes up feeling crappy? She can't really blame her kids as being the source of her sleep issues anymore. She probably should get tested. Can you speak to her and also let her know what treatments are available now in you working with so many people in this field?
Yeah, no, it's a great question, and I think the way to think about this is we don't want the treatment to be worse than the disease, right?
Exactly.
And
Yep.
like you were giving this example of a mom, and if this mom already feels horrible, if the treatment is better than how you feel right now, it's probably going to be worth it, even if it is
Yeah.
cumbersome, right?
Yeah.
So I think that idea needs to be made very clear. But when we think about like the different modalities that are available, we sort of break them up into like what are prescriptive interventions and what are non-prescriptive interventions. And in the non-prescriptive interventions, things that don't require a prescription, is a mix of things that promote nasal breathing and keeping the mouth closed. It could be a chin strap, it could be lip tape, it could be a nose dilator, it could be interventions that change the collapsibility of the upper airway. So sleeping on your side is one mechanism. And there's this thing called orofacial myofunctional therapy. It's like exercises of the upper airway that reposition the tongue, and they don't require a prescription. And most people will benefit from this in some way, shape, or form. And then you have like prescriptive interventions, and like CPAP is one of them. Dental appliances are another. There are tongue stimulation devices that are worn for 20 minutes or 40 minutes, 20 minutes twice a day for 6 weeks, and it strengthens the muscle of the tongue, because the tongue is presumably one of the drivers of the the obstructive nature of sleep apnea. And then there's implantable devices too. And over the next few years, there's going to be even more. There's more devices that are in the pipeline. So with that being said, the idea is not what one modality is available for that individual, but how do we combine different things to help somebody have optimal sleep? Some people, just with body position and modulation of the upper airway with keeping the mouth closed, that can be a good enough solution for their sleep apnea, versus some people who have very severe sleep apnea, they need to be on something like a CPAP machine. So it can be very personalized. And the goal, I think, and you'll probably agree with me on this, is not for us to tell people what to do, but rather to understand what are they looking for and help devise a cocktail of solutions that works best for them in their current environment. Like if someone has young children, I can't imagine, I mean, I have young children too, I can't imagine having to sleep with a CPAP machine on, because they're going to be tugging on the hose every night. And
like when they come to wake you up,
yeah.
tell them to walk them back to bed. I know, right? So I think that's just so incredible. This is really true personalized care, y'all. This is it. It's not about you have to use this, right? It's really tailoring care to your needs, your values, of course, the severity of your sleep apnea, right? We may say, okay, instead of doing non-prescriptive options, let us give you these other options. But I think that's the beauty of this, and really having a tool to then say, okay, we've tested this out, we've tested out this treatment. How does it work? Or how has it improved your sleep? And to be able to check that objectively, rather than just waiting for you to say, yeah, I feel better, or no, I don't feel better. I think that's incredible. Now, I know that you are licensed in most states, which is why I really wanted to bring you on here, because that is a very unique feature of or bonus of Empower Sleep, the fact that you can reach so many people across the US. So tell us a little bit what that process looks like. If I have someone who's like, listen, I do not want to go to the sleep lab. I'm a little bit nervous about the home sleep tests that, maybe I had a really bad day and then the sleep test is going to show that I don't have sleep apnea or I have sleep apnea. Like, I want to do this longitudinally, like you described. What does that process look like, and how can people either work with Empower Sleep, and how do you serve folks in the community?
Yeah, no, thank you. It's very simple. If they just go to empowersleep.com and click on, I think the icon is Fix My Sleep. It'll walk them through a process where they can either schedule a visit or be able to buy a sleep test, and they should be able to do that. It's pretty simple, and afterwards the process of understanding your sleep information is also very intuitive. There's a mobile app that they'll download. The sleep recorder looks something like this, a very simple device that just goes on the finger. You download an app and you get to see your sleep data every morning. And if you have any questions, you can just message us directly through the app, or you can schedule a visit to schedule like a one-on-one virtual consultation that can be billed to the insurance. So we want it to be as frictionless as possible.
Mm-hmm. And I'm here to say, as we close, that I have tested this out because, y'all, I am very interested in these devices. Also because I'm starting my own practice, right? And I'm looking forward to being able to deliver, home sleep tests for those who I feel would benefit from it. And it was the most streamlined process. The device is very non-intrusive. I do not like to wear, apart from my PJs, I do not like to wear anything to sleep, right? So just being able to wear something on one of your fingers all night, it was incredible. And I was able to do it over 3 nights because it turned out one of the nights I had a really bad night. I don't know what happened. I think I was very stressed out and I didn't deal with that stress before going into bed. So I was tossing and turning all night. But then the fact that I was able to get subsequent nights of data, it was incredible. That way I felt more confident when the results came to say, okay, we did the average of these nights and this is what it looks like. And also just the service on the other end with your team, where they reach out and say, okay, what are the next steps? What do we need to do? So definitely I put the link. We're going to have that in the notes as well. If you're even wondering, why do I feel so tired? Why am I, my spouse says I'm snoring, or I'm waking up and I feel like I have a little bit of a headache, or my mouth is dry, or I'm getting up frequently to use the bathroom. And, could this be sleep apnea or something else? Then use this tool. I think it's really incredible. And the fact that there's access across, most of the states in the US, if I'm correct, right?
Correct, yeah. Yeah.
Perfect. Well, any final words, Dr. Chopra? This has been really, really insightful. Thank you so much for sharing your wisdom. And thank you for just pioneering this. I mean, I see this really changing the landscape of how we practice sleep medicine and how we deliver, high quality sleep care to our patients.
Yeah, no, I first of all, thank you for being, a supporter of us and what we're doing and our mission. And thank you for having me here today, Funke. It's been a pleasure. In terms of like take home messages and like last words, I cannot emphasize how important sleep is. When we look at sleep from an evolutionary standpoint, there has to be a very strong biologic reason that we sleep in like this, at least for adults, 7 to 9 hour windows. And when we sleep, the physiology of everything that is going on is different than what it is when we are awake. So prioritizing your sleep and having healthy sleep, it will serve you in ways that you cannot even imagine. And whether it's a child who is struggling in school, whether it's an adult who's trying to have a breakthrough at the gym, or some creativity breakthrough, and Funke, you see this all the time.
Mm-hmm.
Having healthier sleep having healthy sleep makes us feel better, makes everything feel better, and having poor quality sleep makes everything feel worse. So it's you've coined the term. It's the super drug, right? And
superpower. Sleep is a superpower.
sleep is a superpower. So I'm all
Yeah.
for that, and we really want to empower people with the right tools so they can make it their superpower and live the best possible life.
Awesome. Wonderful. So you guys heard it. And where can people, if people want to learn more about the work you do, follow you, or reach out to you, how do they access, how do they get to you?
They can follow us on Instagram. They can,
Mm-hmm.
I think the handle is Empower Sleep.
Okay.
They can follow me directly. They can send direct DM me directly on Instagram too. But the best way would be to just show up on the website, empowersleep.com, and we would be thrilled and privileged to be able to help them and improve their life through the lens of sleep.
Awesome. Really excited. Thank you so much. Again, this has been truly, truly insightful. I appreciate you so much. We are going to stay connected. Again, I have used this tool. I've actually referred a couple of people already. And so if you work with me in the restful sleep place, this might be something that you'll get access to as well. So we're really looking forward to partnerships and really just improving people's sleep health. So thank you, thank you, thank you.
Thank you so much, Funke. Thank you, everybody, for joining.
All
Wish you guys
right.
all the best. Take care. Bye-bye.
Bye.